Hello, welcome. Now, in this webinar, I talk about Handy Plasma Excellence. Is an Italian product, is distributed by Taumed, and we CA 0051. Let me to introduce myself. I'm a professor of I'm a professor in the University of Camerino and Turin, and I'm secretary of SIMECNA, International Society of Aesthetic Medicine and Nano-Ablative Surgery, and also for another international group named CAMIG. This is my reference about Facebook and Instagram, and my email is important because I'm a tutor also out of this webinar. What is plasma surgery? The plasma surgery with and the plasma excellence consists in nano or mini ablative surgery and ablative surgery. We can treat wrinkles, lifting, age marks, scars, moles, and so on, with ablative or with the nano-ablative, depends on the pathology. So, but with nano-ablative, we can make non-surgical blepharolifting. The synonymous are very a lot synonymous, but I like plasma surgery in general. The handy is a generator of plasma, microplasma. Important is the single hand piece, one piece only, with 5 power levels and with enough 7 power, because we have 2 pulsed powers like a fraction. The current is limited and pulsed and supplied with a long-lasting battery. Because why? I think that this generator make zero electron damage, because we have the skin effect of the current. The electric charges are distributed of the external surface of the body of the skin without crossing them. We haven't eddy currents bifocal. What is plasma? We have 4 states of matter. We have more, but 4 states: solid, liquid, gas, and plasma. With the handy, we can make a potential difference between the tip of the handy and skin. And we ionize the atmospheric gas, creating a sublimation of the tissue. It's different from laser, because we have a chromophore, we have a light and a let of wave. There isn't also isn't a electroscalpel or for radiosurgery. We have in effect an electric arc, but it's different because basically we have 4 states. It depends on the temperature, the Coulomb forces, and how much energy is particle have. And in solid, we have a low degree. And if you like a microwave, we excited the ionization, the gas, we have a plasma. In physics, plasma is an ionized fluid in dynamic equilibrium. Like blood, blood, we have electron, proton, and negative neutral particle. And if we supply energy at non-ionized gas, we can bring, it's possible to bring it to the plasma state. The energy required to obtain the ionization of the gas can be administered form in heat or, in this case, electric potential. For ionized indicates that a significantly larger fraction of electrons have been stripped from their respective atoms. If you see a gas in a confined box, you see only the glow, not the spark. It's like a neon, old neon. The formation of plasma is different under atmospheric pressure and room temperature. I prefer to define the gas ionization via electric current. Then we haven't a true electric arc, but a ionization arc. Because we have a dielectric gas failure becomes a conductor. It appears with with the globe, but the spark. The distance, the gap distance, is very important because we have a distance between tip and skin, the tip of the electrode. And when the ionization gas touch the skin, we have a sublimation. We have a passage to solid to gas. In effect, ablation, the sputtering phenomenon, and is important, this effect, because we have electromagnetic current, a microcurrent like injury current. We have a sublimation. We haven't damage surrounding the skin, but under the skin we have a derma, and derma change in the elastin, and we have a significant interdigitating new collagen, because it's very important. The ionization arc touch the skin. We have a sublimation of the skin, the stratum corneum. We have a Faraday, like a Faraday cage, the skin effect of the current, but we have results under the skin, in the derm. It's very important, this article, and this by Professor Tsumas. In this slide, I show that we have a sublimation of the epidermis. This is epidermis. We have the basal membrane in blue, in violet. We have a little acidophilia of the skin to the minimal induction of the heat shock protein. It is very important. The other effect, we have a fossification and new way of the elastic fiber. Another article showed that we have a regeneration of the skin tissue with collagen 3. Then is a new collagen, not fibrotic collagen, but is a collagen for the young people. It is very important, the regeneration of the collagen 3. The production of plasma generates electrons, electrostatic field, and electromagnetics. We have the electrical stimulation by this microcurrent formed by the plasma, and we stimulate the migration of the dermal fibroblast. It's amazing that a little spark on the skin can modify the collagen and the dermal and the fiber elastic. In 2010, we have the plasma medicine possible application in dermatology. We have 5 points of the star that resume my way of thinking. Heat, charge particle, reactive spaces, ultraviolets, electric field. Then with plasma surgery, we can make very great results, not only on the face, but also on the body. How to improve this technique with the handy? We have two technique. I like the Spry Technique that remove without any retraction the skin. And we have a spot technique in a triangle mode, and we have a lifting effect. Then we have always in a triangle technique the dye spot. 5 spot makes 4 triangles. Okay, sorry. 2 techniques, 3 triangle spot that lifting, shorten, and 1 technique is a spray. The spray, we haven't effect, we haven't anything. We remove ablation of the skin or the pathologies. When I talk about speak about a spot, a triangle, you can see 2 methods for make it, or a zigzag method, but we have a triangle, or you make a row and another row beneath. The spot technique with dye spot, the 5 spot, we have a great result when we have enough skin. It's important to make a triangle. We have an example. The spot should have a diameter 500 micron. It's important that it's not too far from each other, but near 1 millimeter, more 1 millimeter. We have in this case the lifting of the skin. We can. It's important to don't make spot inside the wrinkle, or in this case inside the scar and so on. We can make the spot with 5 power, and with the 2 Fraxel pulsed power. This type of technique used usually for blepharochalasis, wrinkles, and excess of the skin in general. The triangle spot make a very lifting effect on the skin. The Spry technique, we use this technique when you want to erase the, in this case, the lentigo, or like this. You see the lentigo, very gently, you brush very gently with the handy, and you remove without retraction. It's very important, this concept, because we have the law of Joule. Energy is equal power for time, watt for second. It's important because we have the energy that depends on the time of exposure. We can stay 10 seconds our finger on one candle, or 1 second on 10 candles. We have 10 watt. We have this same energy, but you burn your finger if you stay 10 seconds on one candle. Why this is important? Because we have the time, you can choose the correct power level in relation to the thickness of the lesion, thickness of the skin, or both. And depend on the thickness of the skin, the time, for instance, if you touch, if you want to treat the eyelid, you stay 1 second. Or in case of stretch marks, periumbilical marks, you can count 2 seconds. But if you want to lift the knee or the elbow, it's possible to stay also 3 seconds. But if you want to make a hole, you stay 10 seconds. This is very important. When we make a treatment, generally it's important clinical evaluation, informed consent, and photo. Photo before, during, and after the treatment. Because generally our patient is a crazy patient, and it's very important to remember after the treatment. And the photo is very, very, very important. The patient must be in good health, with no anti-inflammatory or anticoagulants drugs. Is a relative contraindication, that's important. For female, I prefer don't make the treatment during the menstrual cycle. Of course, when the area, the skin, shows signs of inflammation or infection. And we have a little risk when the patient is suntanned, because when you ablate the stratum corneum, you ablate also the melanin, and the difference between the skin and the new skin is very big. But the goal of the plasma is blepharolifting. This year, I think that I have 3,000 patients for blepharolifting in 5 years. The blepharolifting is a very big results. If you see immediately after the treatment, you see the spot, possibly in triangle technique, and with a triangle area. The 5-spot technique, when you want to lift the fold, you can make the die spot. When we have a minimal fold, you make the zigzag. If you see, I put my finger on the eyelid. I create the extra fold. For create also the new vectors, is important this method, because I create extra fold and I sublimated the area in vertical direction and under to upper. Here you see my finger and you see the zigzag method. Usually I come to horizontal skin, then in vertical. It's important also the test, because the patient is particular, is non accept, sorry for my English sometimes, the crosses on the eyelid. And I make a test in central area, and you see the retraction, a little bit retraction of the skin, and you say at the patient, you make the aftercare for 1 week. It's important because the test is carried out to assess the response of the patient's tissue and their compliance with our precision. Table, aspiration smoke, benzalkonium chlorurum, chloride, TNT, tissue no tissue, and glows, neutral glows I prefer. It's important when you bring the piece, the hand piece, is to search stability. Then it's important to support your hand, because if the patient move the head, you move consensually your hand. If you see the little spark, we have 0.5 millimeters of gap distance. It is important that this handy plasma make a spark a little bit yellow or white. This means we have a very good type of plasma. This is my patient, 40 years old. We have a blepharochalasis. Immediately after the treatment, we have a retraction, important retraction. We have a heavy eyelid, upper eyelid. And then the day after, we have a little bit of edema. The edema depends on the how many vessel of lymphatic vessel you close with the spot, or with each spot. Depends of the patient response. But I found a gel that reduced the edema. I speak about after some minutes. We have in front of the retraction. After 21 days, we haven't crossed this. The crosses, carbon crosses fall down in 1 week. We have a very good results, a good retraction. You think it is only one treatment. Usually I make 2 or 3 treatments. This depends on the blepharochalasis. But after 2 months, we have another bit chalasis. It's possible. In this case, the other eye no, but this eye, yes. I repeat the treatment. And the results, not perfect, is this after 4 months. This is the movement of the eyelid when I make only vertical spot perpendicular of the longer lines, and we have a retraction. Now it's important to have a sublimation, ablation of this part of the eyelid, the horizontal part. But if you want to have a big result, you make a big area. If possible, you make a triangle area, but we have a very big lifting of the eyelid. This is the first part, first session. In second session, I sublime also the internal part of the eyelid. It's possible to treat all the eye, but I prefer in 2 times because we reduce the immediately after edema. This is a good result. We have a sublimation of the horizontal and vertical, and you make a dye spot for a big retraction. For blepharochalasis, I prefer generally use the medium power 3, sometimes 4, but or Fraxel 1. The Fraxel 1 is level 3 of the power, but pulsed, and with a very speed pulsed, the patient don't feel pain or heat. I use this Fraxel when you have a heavy, very heavy eyelid, also in this case, but after 30 days, we have a great results. Is only session. We repeat the session for 1 time. In this case, we can treat not only the upper eyelid with this kind of new vector for lift the eyelid, but also the crow line. We have a different Langer's lines, and we have a little different technique, always with a spot in triangle technique, but more vertical. In this case, we have oblique vector. In this case, is more vertical. It's not finish treatment in this case. But we have a great result with the crow line, the crow feet disappear after 1 month. For 2 or 3 years, it's very important that In blepharochalasis, with blepharolifting, we have the fixed result for 3 years. Depends on the age or the laxity of the skin. For the under eyelid, we have a great result for no less 3 years. After 10 months, very big results in a very aged patient with a very big crow feet. A male, perfect, one treatment only. And a new, a young lady. It's important. You have, I don't know in English, but in Italian is festons. You treat the this wrinkle. The doctor put the foundation cream, and the patient is perfect for a new day. The result, after 1 month, a new skin, great result, a wow effect. I make a very lot of this kind of the treatment. In this case, 2 years after, 50 years old lady, 20 years old, the upper hour, the under eyelid. We can treat also this kind of the wrinkles, and this is the result after 21 days. 3 weeks after, we have a new skin. This carbon crucis fall down after 1 week. After 3 weeks, we have a good result, a new skin. I want to think this is no fibrotic collagen, but normal collagen, younger collagen. Great results also in old men. The results, this is after 6 months, but after 2 years is the same eye. Or you can make a simply ageless rejuvenation of the eyelid in this 40 years old lady with a wow effect. You can use endoplasma for the treatment of the scar. Sometimes we have the scar from the classic normal surgery, blepharoplastic. You remove with a spot, very nearest spot. And about the edema, if you treat the upper and under eyelid, we have a big edema after 1 day, medium edema after 6 days. Is a gel very important gel that the edema, and after 5 minutes you put it on the skin, and we know the property of the chamomilla. Is very useful method, old method. After 2 days, generally, this is the edema. After 3 days, we have a little bit of edema. You see the foundation cream that cover some crusties. after 5 days, we have no edema. We haven't edema. Some crosses fall down, some crosses here, but is covered. I show you different eyes, different people. And it's important, this video. I hope that you see well the video, not in slow motion, but this is my, sorry, this is my video, 3 minutes for one result, one blepharolyfting. I started with the horizontal row, the natural excess of the skin, triangle method with the zigzag, and if you see immediately the retraction of the skin, and I started with a zigzag method, sometimes touch the skin, but it doesn't matter. We have always a little gap. I search extra fold with my finger on the front of the patient. I make the zigzag. It's important to reduce the heat. And this is my new method. I named this circus tent, like a circus. And you have a new vector that versus one point of the triangle. It's very important technique because I have a good result with this. Then I have a good retraction. I treat the other part that I see because it's dynamic. You see the open eye of the patient. Then I search extra fold vertical. And when it's possible, I make a 5 dies spot, like in this case. If it isn't impossible, I make a zigzag. If you see, I search extra fold, I see the movement of the skin, and in 6 minutes, you make a blepharolyfting. Okay. We can use the plasma for the xanthelasma. No surgical treatment, but with the plasma is perfect. We have a restitutio ad integrum, perfect restitutio. It's important to brush the yellow part of fat. We sublimated with the Spry technique all the surface of the xanthelasma until the basal membrane. You see the basal membrane here. You see in this border again the fat, yellow part. It's important to sublimate also this. You sublimated the fat. Then you brush with the cotton or TNT, and you repeat the session. In the same session, you repeat the treatment, the ablation with the Spry technique until you see the basal membrane. it is important to remove gradually and delicately the carbon deposits, ashes, or because very gently, because it is important to not see blood. And you remove the lipidic accumulation. Usually for the blepharolifting, I use topic anesthesia, only topic. And in this case, sometimes topic, sometimes I use a little bit of lidocaine, but one drop for reduce the pain or for reduce this heat sensation. After 1 week, only 1 week, we have a new skin. We have a new skin that after 1 month is normal skin. If we have a big xanthelasma, you can repeat the treatment after 1 month. Usually 1 session is enough, but depends on the xanthelasma. But we can treat it on the smoker line with spot technique and triangle method. The method of this kind of the results is by my professor, my teacher, Professor Giorgio Fippi. I was his pupil, and now the professor of the plasma in university. In this case, you sublimated the not inside the wrinkles, but in this part of the wrinkles, you see the spot. We have results, incredible results like this. In this case, I want to tell the truth. I reduce the wrinkles, but I use also the hyaluronic acid like Revolax Deep. But we have another lady. It's important to treat also the wrinkles of the front. We have a lifting of the front. Only this row, you see here a little bit hyperchromic skin, only this part, and you have a lifting also of this. It's very important to know that the plasma is very, very good result in acne vulgaris, because we can use the plasma on the black head, open comedo, white head, closed, in papule pustule, also in cystic on the nodule acne. You make a spark and you open the comedo. The black points or the white point like this. You make a hole, a little bit sublimation, 2 seconds perhaps, and you open gently the comedon you squeeze the comedon. In this case, we have a papula and pustules. You make a spot for 2 seconds on the pustules. You see the pus. Then, because you don't know where are the exit of the cystic of the seborrheic glands, you make a little bit spot around the first spot, and you squeeze very kindly, very softly the pustules. If you have a papula, you make only one hole for 2 seconds, a little bit hole, and you open the papula. You see the pus, serum, and fat. You see my little spot on the papules or cystic. You squeeze. You make a area with the triangle upper and lower the wrinkles. After 6 months, with 2 sessions, we have this result. In this case, we have a surgical scar. And with 2 sessions, you sublimate the mountain, not the valley, and then you sublimate the rest of the skin. It is very useful with this kind of the scar after acne, cystic acne. Very big scar, very big work, 4 sessions for a new skin. If you see, my method is only spot, not inside the scar, but on the border of the scar, always on the border. In a confluent method, we have a big area. I treated left, right, and center another session. You can make also the preauricular lifting. After 40 years, we have this kind of the wrinkles. Each wrinkles is 10 years after 40 years. In this case, we have 1, 2, 3, 70 years old, and you remove always in spot method, non-spray method. For we have lifting, and you remove the edges of the skin. You can use it for lentigo, brown marks. In this case, it's very important to know the FIPI method, my teacher. That is the circular or annular anesthesia. You, with spray, you design the border of the lentigo. Then, with low power, power 1, maximum 2, you remove this lentigo. You brush gently with a cotton, and you see the new skin. It's important to sublimate also the border. Then, if we have a similar lentigo, like this, you ablated, but no remove the carbon crustes. This is important for us for know the how deep is the lentigo, epidermal or dermal. Also, the very big lentigo, Spry Technique, low power is very important because you don't burn the skin, and you remove, and you see the basal membrane because you see some drop of blood. When I speak about the power, lower is 1, 2, medium is 3, 4, maximum 4, 5, depends on the skin, depends on the lesion. We have a lot of electrode, needle. We have a very thin needle or medium needle. You can use the pulsed method, but is an expert technique. I suggest to use the normal 5 power. Then, when you are an expert, you can use the pulsed power. It's important to put always the handle unit in the charge, the wireless charger, because we in this way we have the unit at the maximum power or recharge. You can remove in Spry technique also this kind of fibroma. You make a circular anesthesia, then you in Spry technique power 4, you remove, you start in a border, and you remove gently the carbon crusts, and you are in the center. Sometime we have a vessel, a vein vessel. You use the maximum power, 5 power. You close the vessel, the vein, then you can remove all the neoformation. In this case, you can shave the fibroma for a histological exam. No, in this case, because I tried to spray the fibroma, but we have a new skin. Or in this case, you remove, in this case, you can remove with like a shave the fibroma, and you can examine with the histological method. Single session. For the small fibroma, it's important to pull the fibroma, and with power 4, you remove the fibroma, and with power 1 or 3, you finished on the skin the job, for not to have a introflexion of the skin. For keratosis, seborrheic keratosis, you can use, in this case, Spry technique for only always in circular anesthesia. Then you remove this with the carbon. You put the cotton with the benzalkonium chloride, and you wait 1 minute. Then you ablate, sublimated again the formation. And you see that this formation fall down after 1 only treatment. You can close also the little bit angioma or spider angioma like this with height power, or mucosele if you dry very well the part, because if it's wet, you don't make a flash, you don't make a plasma, and you remove the mucosele. My aftercare, before the treatment, 1 day before, I suggest arnica composite or arnica for 5 days, reduce the edema. My technique uses the anesthetic cream. Everybody know the EMLA. For me, it's perfect for plasma, not for other treatment. Half an hour, or in occlusion, or if you can put each 5 minutes a little bit of cream for 6 times, half an hour, 6 for 5, we have half an hour. Marsiglia solid soap after the treatment for wash the face, for wash the part, for remove very gently the foundation cream that I put in during the treatment. Benzalkonium chloride for disinfect during the crustis, in presence of the crustis, and you cover with a fluid foundation cream. For protect, I don't like cream, sun cream, but foundation cream, because we have a physic filter, because all the light can to make hyperpigmentation. When the crustus fall off, only wash and fluid foundation. The protection of the skin depends on the single person, single patient. Generally, I suggest for 60 or 90 days, until 3 months, until you see the skin with the pink color. For me, avoid cortisone creams, the pigment, and the sun cream. In my practice, I never use this. This method is a good method, but it's very important to know the technique, to know the technique of method of IP. In this case, we have, of course, a lifting of the eyelid, the upper eyelid, but we haven't lifting, because you don't see new vector. You see in the closed eyes a lifting with a lot of the spot, but no retraction. In this case, the doctor used no good plasma device, because it's very important buy the plasma device like handy, of course, with a CE certificate, because generally we have radio frequency or much power, in this case, the damage of the skin, the scar after this treatment, probably. In this case, we have treat the scar, the wrinkles, pardon, the wrinkles of the face. It's a good idea, and we have sometimes the results, but it's too big. We have a big crosses. It's possible that break, and it's possible to have hyperpigmentation. And for me, is a too big spot. In this case, with the handy, I use power 3. Also in this case, too big crosses, too big power, not enough distance from each crosses. Or in this case, that the patient covered with sun cream or with figure, I don't know, we have a blepharitis. like this patient, no good handpiece, no good plasma device, no good power, and we have a blepharitis, but fortunately we have the skin, the power of the skin for regenerated this damage. This is a mistake from the doctor. This is another common mistake made by beautician. In some country, the beautician can use the plasma device and with the lidocaine, but if you see the skin is like a mountain. You don't see the excess of the skin. And with a big, very big electrode, you make one inside. This is a mistake, a big mistake. This is another American beautician that treated the face, all the face, incredible, because of course we have hyperpigmentation, we have a lot of spot. I don't know the effective result in laxity. I don't see laxity skin. I don't see a very good distance between each spot. For me, is a mistake. We have a lot of electrodes and very thin electrodes for remove, for instance, fibroma, or this is in this case. But we have also with a sphere. Why? Because with the plasma, if you remember some slide ago, we can make electric current, magnetic field, ion flow, electromagnetic effect. My method is to use this kind of electrode to make a plasma peeling. I bend a little bit the electrode, and you brush very gently the skin. You don't see, if you touch the skin, switch on the handy, you don't see a spark, but you feel the skin very smooth, and you feel the smell of the sublimation. In this case, post-acne scars with this kind of electrodes, power 3 on 4, you touch very, very gently, you brush very gently the skin. You see a little bit, sometimes a little bit spark, but generally no, you don't see spark. And after 3 sessions, you have a reduction of the stratum corneum and of course of the scar. You can put also some substance like polynucleotide, like hyaluronic acid, like amino acid, and you see that this flow of electrons pull the substance inside the skin. In this case, I use the electrode with the ball. You put the ball inside the wrinkles. In this case, inside. You see these results after 15 minutes. In conclusion, Lower power 1.3, medium power 3.4, maximum power 4.5. We have two techniques, Spry and spot technique. We have the electrode that you can sterilize, also in autoclave or in immersion with disinfectant. We have a pulsed mode. You can make all techniques, but it's for advanced people. The important, because the pulsed, we have minimal heat transfer and discomfort for the patient. And we have the wireless charged, and you put the handpiece inside the rechargeable battery. Personally, you see the smoker line of the old lady. I integrated the technique with the plasma surgery and with the other technique. You can obtain great results with carboxy therapy, with linearase collagen, with hyaluronic acid, with threads by Miracu, with substance with Taumed product. Why choose the handy plasma excellence? Because is versatile with 7 power. Is a handsome bellow unit, light touch, because for the lentigo it's very important use 1 or 2, and is ergonomics. I use during these 3 years only this device. Is perfect for my hand. It's not too big. It's perfect for women and men, and you have a very bigger results with a little handy plasma excellence. Why choose this? For price, quality, and service by Taumed. And I thank you, everybody. And this is my email. And now I want to see some question in chat. Which is better to be done first, handy or Botox, handy or hyaluronic fillers or thread? What is the time frame between the procedure? Okay, thank you, Katevan. Depends. If you treat the blepharochalasis, I prefer use the Botox 2 weeks before the treatment with the handy, because we have good results with the plasma excellent, the plasma handy plasma, if you make Botox before, because you don't see, you don't have the force of the switch. And for the hyaluronic acid or threads, doesn't matter when you want, because the plasma surgery is an epidermal surgery. You, in this case, use in dermal surgery. For the fillers, you can wait the normal skin after the plasma surgery. Thank you, HackerMed. When you treat stretch mark, do you treat the area inside the stretch mark or around which electrode you use? Note the border of the stretch mark, never inside the stretch mark, because you increase the depression. And I use the electrode, medium electrode, not very fine electrode. Is important because in this case, for the stretch mark, it's important to have a good spot. For the under eyelid, I prefer the little electrode. For the upper eyelid, I prefer the medium electrode. In this case, for the under eyelid, is very important the speed for the spot, because the sensitivity of the skin is very important, not like the upper. For the stretch mark, I use always the spot technique. Spry technique only if you want to remove scar or new formation, nevus, keloids, sometimes keloids. Is not very easy. I need to speak about keloids for half an hour. In generally, I use the power medium, the power 3. 2 or 3 for stretch mark, for eyelid, and for the brown marks, always 1 or 2, no more. This is very important.
Hello, everyone. Thank you for the time you spent with us, and thank you, Professor Turki. It's always a pleasure to have you here. If you don't have other questions, please remember that you can always write to us or directly to Professor Turki. Thank you very much for being with us. A copy of this webinar will be available for everyone, so just send me a request. And I wish you a happy day and a happy evening. Thank you very much, Professor Turki. Thank you very, very much, everyone. Hope to see all of you soon.
Thank you, everyone. Thank you, and a good day.
Have a nice day. Bye-bye to everyone.